I'm Anil K. Sharma. I'm son of Mr. K. Kishore. We were in Delhi and we saw that he had a mild MI. And then we found out that ECG was abnormal. And then I got in immediately the very next day to here because Sterling is something that my mother and father has always been here for. And then we got here and then his troponin was positive. So we understood that he already had a MI earlier and he carried on with that for 4, 5, 6 days as a matter of fact, or even more. And then we immediately admitted him and then we found that his creatinine levels were high and it went up to 9 and he had pulmonary edema. So it was a case where the creatinine was affecting his all organs and the body function and the metabolics. So it was decided that immediately the team of Dr. Karishma and Dr. Madhav, Dr. V.C. Chauhan, they all had met and then we discussed. And then it was decided that what should we go for? Should we go for dialysis? Because my dad was not ready for dialysis. He wanted to manage himself without dialysis. So then ultimately it was decided that we need to know that what is the blockage, because I, as a pharma company man, I wanted to know that what is the status. So they said that we'll take him on dialysis first, settle his body a little bit, and then take him on angiography. And when then they had gone for angiography, they found that there were blockages, 90% in all the three. So it was a critical case. And then Dr. Chauhan discussed, and then all the team sat and they decided that we should go for a bypass surgery, and that's where we got the man, Dr. Gaurav Goyal. And he said that we are going for on Saturday morning, you can have your cup of tea with your father. He was very confident, and that's what matters basically for a patient relatives. And then the surgery has gone really very well. And at the age of 86, a man with pulmonary edema, a man who is on dialysis, whose body may not support, but we took the risk together and we were prepared that if this clicks, he has few years to live. That's what was our intention, and we succeeded. The bypass has gone so smooth. And Dr. Madhav, then in between we had a problem. He had a tachycardia where his heartbeat went up to 135, 140. And then his oxygen requirement went to 6-7 liters. And then we were little, and he has patch because of the earlier infection. And then that is where Dr. Madhav got in, and he was so aggressive. He was like a son. He managed my father. Like today also he has ICU psychosis, but when Dr. Madhav comes and he said, "Do you know me?" He said, "Yes, I know you, Dr. Madhav." So I think that's the connection that as a patient he has built up with the doctor, because the most important element is the trust of a patient on a doctor, and that's why the human angle has to get connected. You need 5 people to replace Dr. Karishma because she's everywhere. She is so devoted and so responsive. I still remember when father was admitted and we had troponin positive, and I called up Dr. Karishma, and the way she picked up the phone and responded, I think that's the beauty. At 11:30, 12 o'clock also you get messages, reply, you get updates. I think that is what we want as a matter of fact, because I understand it, but there are laymen as relatives, they would like a doctor to be responsive, and that is where I think the doctor have scored over. So Dr. Karishma is a Karishma. That way she stands by her name. And apart from that, I think the ICU, the cardiac ICU was fantastic. All the doctors have been always on toes. All the nurses have been fantastic. They have really taken care of everyone. And I think if my father has been able to come out of this challenging time, it is all because of a collective effort of the Sterling team and the will of the patient to live. Possibly the will of the patient to live is also because of the surrounding that was provided as a son, daughter, relatives, and the doctors who behave like a family. And I think Sterling stands apart. I'm not saying this just to make a good statement, but I think on an experience part, I would say that this is a place that you don't feel like a hospital. And the hospital cleanliness, the hospital canteen, the hospital staff, the hospital management, the hospital security, I think you don't feel it is a place like a hospital. You feel as if it is a state of art infra for good wellness.